everyone. Thank you so much for joining us today for our webinar, Managing Eating Behavior in Times of Uncertainty and Stress. I'd like to remind you all that if there's time at the end of this presentation, we'll open it up for questions, which if you're attending through Zoom, you can ask in the chat box or the question and answer portion. If you're joining us on Facebook Live, you can just leave us a comment. Our presenter today is Dr. Kim Claudat. Dr. Kim Claudat is a clinical psychologist and co-director of the Adult Treatment Program at UCSD Eating Disorders Center for Treatment and Research. She received her Ph.D. in clinical psychology from University of Nevada, Las Vegas, and completed her pre-doctoral internship at Sharp Healthcare in San Diego. Dr. Claudat began her work at UCSD Eating Disorders as a postdoctoral fellow, working in both the adolescent and adult programs. In addition to providing individual, group, and family therapy in the adult treatment program, she runs the Transitional-Family Program for young adult patients and their loved ones. She has received specialized training in cognitive processing therapy, PTSD, and as a CPT provider, provides this treatment to patients presenting with comorbid PTSD. Her clinical and research interests focus on the connection between eating disorders and emotion regulation difficulties, as well as treatment development and outcomes. Although her research and clinical work has mainly focused on eating pathology, she has experience providing evidence-based treatments to children, adolescents, adults, and their families with a range of presenting psychiatric problems across various treatment settings. And thank you, Dr. Claudat, for joining us today and presenting your research. I will give you the floor now.
Great, thank you so much for having me today. I'm really excited to be here. And as you mentioned, really my research and clinical interests mainly focus on the connection between mood and how people regulate mood through behaviors such as eating disorder behaviors. And I have a lot of interest in the connection between eating disorders and comorbid conditions like mood disorders and trauma and substance use disorders. And so I'm really excited to talk to you guys today about really how to manage eating behaviors in times like we're currently going through, where there's a lot of stress, uncertainty, and a lot of intense emotions that come up. So I will be showing a PowerPoint throughout my presentation today, just to highlight some main points and really so we can follow along with some of the things I'll be discussing. And at the end, I'll kind of shut down the PowerPoint so we can talk again in a way where you guys can ask questions. I'll make sure to leave time for us to do that, because I really want today to help those of you who are viewing to be able to answer specific questions you have, or be able to give some feedback on things that could be helpful if there's specific things that you're struggling with or know people that might be struggling with these things. So I'm going to go ahead and share my screen so that we can, okay. Lauren, I'll need you to let me, allow me to share my screen if possible, because right now it says I can't. Okay, let's see here.
Perfect. I think I just allowed you to go ahead and try them.
Thank you. Okay, so hopefully everyone can see my slides here. If not, just give me a heads up. But as was mentioned, I'm going to be talking today about how to manage eating behaviors in times of uncertainty and stress. And I first just want to give some background as to why I'm talking about this and how it's related to hopefully you guys and why you're here today. And so, as was mentioned, I really have most of my specialized experience in working in specialized eating disorders treatment. And what we know is that even though eating disorders, clinically diagnosable eating disorders, occur in only about 1 to 3% of the general population, and we see that up to 50% of the general population engages in problematic or disordered relationships with food, body, and exercise. And with that said, a lot of what I'm going to be talking about today is more generally these types of disordered relationships with food in particular, and how that can come up in connection with people's mood and when people are struggling with stress. And why these two things are so connected, interestingly, we find is that really mood and eating are very highly connected. we see that in eating disorder populations, for example, up to 70% of eating disorder patients have some type of mood disorder. And 1 in 3 people with bipolar disorder meet criteria for an eating disorder. So these two things, mood and eating disorder behaviors, are highly linked. And so as I mentioned today, I'm not going to necessarily be talking about diagnosable eating disorders in particular, but rather more broadly disordered eating. So I want to first highlight what that means, because I think that that can be confusing to people. What's the difference between an eating disorder and disordered eating? And so when we think of a diagnosable eating disorder, this is something that's clinically impairing. It meets certain criteria for us to have that diagnosis. Whereas disordered eating can really be a range of problematic relationships with body shape, weight, as well as eating behaviors. And so I have listed here just some general examples that we see. So this could really be if people have distorted body image, where they, even though they're in a healthy weight range, they continue to believe they're overweight. We might see excessive or rigid exercise behaviors, obsessive behaviors around food, including calorie counting. Maybe we see high anxiety about foods, or just a rigid approach to eating. So for example, avoiding certain food groups or having really strict food rules. And then a lot of what I do want to talk about today or focus on more is these types of overeating or binge eating episodes, or episodes where people feel a loss of control. These seem to be the most common behaviors that we see in the general population, and they're highly associated with stress and mood. And we also see people reporting things like eating to cope with emotions, right? So we call that emotional eating, not eating necessarily when hungry or when it's nutrition-based, but more as emotional coping. And I also want to put out there that some of these things, just because you engage in some of these things, I think they're very common. It doesn't mean that you necessarily have a problem, but I think where we want to intervene or figure out how to do things differently is if any of these behaviors or situations are causing distress for people. And so I do want to highlight binge eating a little bit more, just because I mentioned we do find that, up to between 7 and 13% of the general population engage in regular binge eating episodes. So this is certainly not an uncommon behavior. And I want to clarify that when I say binge eating, what I mean is eating an unusually large amount of food in a discrete period of time, accompanied by a sense of loss of control. So in a binge eating episode, someone feels like they can't stop even though they want to. They feel out of control. It's very distressing. It causes a lot of guilt and shame. And really, the most common predictors or factors associated with binge eating that we find through research is that binge eating is typically impacted by either one or more of the following. So it's usually predated by negative mood. So people experiencing a negative mood state and then using binge eating as a way to cope with that. It's associated with low self-esteem. Dietary restraint here really means if people are cutting out certain food groups in their diet, if they're aiming to maybe restrict or eat less of a certain food item. This often predicts binge eating behaviors, and I can talk a little bit today about how we address that. And then also beliefs about eating. So oftentimes before people binge eat, there's a thought or belief that eating will make me feel better, or I'm going to eat as a reward. So there's usually beliefs associated with the positive connotation of what binge eating will do for that person. And so how are these things all connected? Really what I want to highlight today is that stress and health are very much interconnected. And we find that there's a negative association, which I'm sure is not surprising for people, between stress and physical health, but also in people's behavior. So when people are more stressed, their behavior changes. And a particular behavior that seems to be impacted by stress is eating. So we find that eating may serve as a coping mechanism for dealing with stress and intense emotions that come up with that. And how someone responds with eating behavior change with stress, it really depends. It can be different from person to person. So some people might find they have less of an appetite, they eat less, they feel better when they eat less, they forget to eat, it's just not as much of a priority. For other people, it might look like increased food intake. So maybe they're eating more high calorie foods. Maybe they're engaging in binge eating episodes or eating to cope with their emotions. Or maybe eating just becomes more mindless and less of a priority. And so depending on what the stress response is in terms of the change of eating behavior, that's going to depend on what skills you can utilize to manage that. And that's what I'll be talking about specifically today. And so just to get more of a visual of how this might work, how mood, stress, and eating behaviors might be associated, I like to use this emotion regulation model to help us understand that a little bit better. And so I'll just walk you through this briefly, but what this looks like is if you look on the far side where it says cue or trigger, what we see is there's typically some type of, whether it's internal or external, right, stressor of some sort that comes up. And then that leads to what we call emotion dysregulation, but I think really you can just insert here, instead of using that term, just like intense emotions, emotions that feel out of control or people don't know how to manage them. And then basically if someone doesn't have skills to manage their emotion, they try to find a way to avoid or reduce that intense emotional experience. And for many people, through some type of life experience that comes through some type of eating behavior change. So maybe they find when they're really stressed, they then, go off and just kind of engage in this binge eating episode. They eat all this food, their mind's not focused on the stressor at all, it's completely blank or it's completely focused on what's in front of them. And this provides some type of temporary relief, which then reinforces this cycle. So you'll notice the temporary relief then comes back so that the next time someone experiences that stress or emotion dysregulation, the behavior is used again because it provides relief, right? As humans, we do things that make us feel good and we avoid things that make us feel bad. So that's how this cycle can continue and be really hard to break. So where we would intervene is figuring out when intense emotions come up, how do we insert skills there instead of eating behaviors to help cope with that? So how does this connect to where we're at today? So I could imagine this goes without saying that currently with the situation, the health pandemic of COVID-19 in our world right now, there's a lot of stress coming up for people and a lot of uncertainty. And so I know we're farther along in the process now here in the United States. And, there are still certain restrictions like stay-at-home orders in some areas, as well as social distancing. And what this has led to is experiences of isolation for many people. And what happens when people are isolated is these are risk factors for intense emotions such as anxiety and sadness, anger, loneliness, boredom. And these are all emotions that people typically try to find some type of way to get rid of or avoid. And also with the current state of the world, there's really a lot of disruption in people's current routine. Our day-to-day lives look very different than they used to. Maybe your work routine's different, or you're not in school, or you're in a different setting. And so there's a lot of disruption in what people are used to in their day-to-day, which causes a lot of uncertainty, disorganization, and there's a lot of economic and financial stressors currently going on for people. All of that combined with, we have this unique situation where not only are people's lives more stressful and uncertain, but then we have this relationship that's different with our current access to food. So for some people, given limitations of, maybe wanting to expose themselves out in the public, may, when they go to the grocery store, have less frequent trips, but have more food stocked up at home. So there's more food readily available in the home setting. And for a lot of people who struggle with eating, disordered eating behaviors, this can be a really risky time to have that much food and that close of access, especially if you're working from home or engaging in school from home. It's more readily available. On the flip side, you might have limited access to certain foods. So once again, maybe your grocery store doesn't have certain foods, or you're not going as often, so you have to make do with the foods you have, or the price of food has changed. And so really on either end of the spectrum, people's access to food may be interrupted by the current state of the world. So what I'm going to be talking about today is a variety of skills to cope with this. And like I mentioned, really the skills that you use are going to be based on what's impacting the disordered eating behavior or the irregular eating behavior or problematic eating behavior. And so I'm going to talk about these skills listed here today. And as I mentioned, if there's specific situations people have or questions you have, we'll definitely save ample time at the end to talk about how this might be specific to people or answer questions people have. But I do want to highlight that the skills I'm talking about today are mostly skills taught in dialectical behavior therapy, or DBT. That's the type of therapy that we use here at UC San Diego Health Eating Disorders. And it's a therapy that has proven to be really helpful in helping people regulate their emotions, and specifically designed to target problem behaviors that people use to regulate emotions. So a lot of what I'm going to be talking about is going to be based on both DBT and general cognitive behavioral therapy skills. So let's talk first about how to target and change eating behaviors if they're problematic, right? In other words, how do we create more healthy eating habits, more regular and balanced eating? So once again, I know that I mentioned at the beginning that people's response to stress might look very different, whether they engage in more eating or binge eating or overeating when stressed versus food restriction. But really, either way, whether you're someone who struggles with overeating or undereating, regular balanced eating is the goal. It's the key. And I am not a dietitian, so I want to say that in terms of nutrition knowledge and that type of expertise, that is not in my wheelhouse. However, as an eating disorders clinician, there are some just kind of basics when it comes to a balanced eating schedule and to the type of variety we see in diets, that just kind of general principles that I'll be talking about today. So the first and foremost thing that sounds really simple and is so hard for people, and especially when stressed or busy, is regular eating. And so what I mean by that is really eating regularly throughout the day. And for some people, this might be surprising because really I think our eating schedules all are so different. But the goal is really regular eating every 2 to 4 hours. So the reason why we have that time frame is it's essentially enough time that you're not getting too hungry within that span. Because when people get to the point where they wait too long to eat, or they're too hungry, as I'm sure some of you have experienced, that puts you at risk for more overeating episodes or kind of more impulsive eating or dysregulated eating. And so if you kind of keep to a regular eating schedule of 3 meals and 2 to 3 snacks a day, that really helps people stay kind of in a structure throughout the day. And so on that note, really when it comes to regular eating, structure is very important. So each of you may have a very different experience with how you handle eating, you know, and I think for a lot of people, it's not something that's generally planned out. It's something we do when we notice we're hungry, we eat. Some people might eat by the clock. Some people might eat when other people are eating, or just based when they have breaks in their schedule. So one thing I want to highlight is that if you struggle with structure in your daily eating, primary thing is going to be really prioritizing meal planning and an eating schedule to eat every 2 to 4 hours, those 3 meals and 2 to 3 snacks a day. So that might require advanced meal planning. So what I mean by that is, especially if you're going to the grocery store on a limited basis, or there's not readily access to food, or you have to kind of work with the food that you have, planning that out in advance is going to be really important. So figuring out, you know, when will I have access to food? How will I be able to structure this into my day, and actually making the time throughout your day. And for some people that might require some assertiveness, like you might have to talk to your work or talk to your family and say, you know, I need to be eating more regularly, because for some people in their home environment or with the people they spend time with, the people around them might not eat regularly. So it might involve incorporating people in your life to understand that this is something that's going to be the case for you. You might be planning like bringing snacks with you if you have to, or having snacks prepared in advance, that type of thing. And what I want to say with this is, it doesn't mean you have to be rigid. And in fact, we don't want you to be rigid. Of course, there's going to be flexibility. You don't have to eat at the same exact time every single day, but just trying to provide some type of structure with that regular eating schedule. And similarly, we don't want this to become obsessive, but it could be helpful to track daily eating just through something we call self-monitoring. What self-monitoring means is just observing patterns, observing you know, what mood might be impacting your eating, when you eat, how you eat, what thoughts come up for you when you eat, kind of just tracking in a journal. It doesn't have to be anything formal, but there are also apps for this. This is not to say to track calories or macronutrients. It's really just to notice patterns that might come up in your thoughts, eating, and behavior. And really what regular balanced eating is paying attention to hunger and fullness, you know, and we'll talk about mindful eating next, but eating when hungry, stop eating when full. Once again, sounds really simple and not something that a lot of us do. And we really, with regular and balanced eating, want to make sure that you're eating a variety of foods from each food group. And what that means, in other words, is cutting out certain food groups, no dieting. We find that dietary restraint ends up leading to more problematic eating behaviors such as overeating and binge eating and emotional eating, because when people are restricting from a certain type of thing or not allowing themselves to have certain food groups, your body may crave that or want that. It can lead to problematic behavior. So I just want to say that's important in a balanced diet. And then actually taking the time to eat and actually sit down and plate your food. And so a lot of times we eat very mindlessly on the go. Maybe we eat right from a box or eat standing up or eat, you know, grazing throughout the day. And so really just taking the time to eat. So overall, I know this sounds really straightforward, and in some ways it is. The basic principles are really straightforward, and I totally recognize that there's a lot of barriers that can get in the way of this for people. So if people do have specific questions at the end about how to kind of maintain something like this, please let me know. And I won't spend too much time talking about mindful eating, but I'm sure this is a phrase or term that people have absolutely heard before. What I mean by mindful eating, if we think of mindfulness, essentially it's paying attention on purpose in the present moment and really doing one thing at a time, right? So with that said, mindful eating can be really helpful to help people fully participate in the eating experience. And the idea behind this is that it's then, one, you're more aware of what you're eating, you're aware of hunger and fullness cues, but also it can make eating more enjoyable for people, right? If for many of us, we may eat very quickly on the go. We might not even really pay attention to what we're eating and miss out on the experience of foods when we're, you know, not really sitting down to observe the texture, the color, the smells, really taken all through all the senses. That's what I mean here by observing, describing, and participating. It's really observing what's going on within you and outside of you. Kind of describing that in a non-judgmental way and then fully participating in the moment. So one other important thing I want to highlight here, and I'm happy to answer questions about this too, but mindful eating for this approach, it really means approaching food with a non-judgmental stance. And what I mean by that is not labeling foods or evaluating them as good or bad, but really looking at like, if it is for what it is, just like descriptively describing it. I think in our culture, we demonize certain foods. We absolutely label foods as good and bad. And what we find is that for people that engage in disordered eating or problematic eating patterns, there's often these judgments associated with food that lead to problematic behaviors, right? If you feel that a food is bad and that there's shame associated with eating it, let's say fast food, for example, but you actually like that food, there might be a lot of guilt and shame associated with having it, this forbidden food. And for some people, when they do indulge in that, it then leads to this all or nothing behavior where they feel like, well, I've already messed up or I've already eaten this thing that's bad. I may as well just go all out. So that's one thing I want to highlight, and I'm happy to answer more questions about or talk specifically about towards the end. So those were some skills generally to manage more regular eating. And like I said, I know that seemed very basic and very simple and straightforward. And truly, when it comes to managing eating behaviors, those are the most important points, right? Structure, routine, planning in advance, regular eating, incorporating all foods, and really working on a non-judgmental stance towards food. So that's one way we can target some of the factors that contribute to disordered eating behaviors. But now I want to talk more specifically about skills to manage stress and intense emotions. Because remember, at the beginning, we highlighted that often what predates or kind of happens before someone engages in disordered eating behaviors is they don't really have the skills to manage stress and intense emotions that come up. So eating becomes a coping mechanism. So for many people, if you can find skills to manage stress and these intense emotions, it then in turn helps with eating behaviors. So I'm going to talk about a few different skills that we find in CBT and DBT are really helpful for people to manage different emotions. And so the first skills I want to highlight, I think for anyone, whether you struggle with anxiety or just a lot of stress, right? If you think of anxiety and stress, they're very physiological experiences. Our nervous system gets activated. We notice a lot of tension, maybe differences in our breathing or heart rate. So it's very physiological. And so with that said, if people practice self-soothing and relaxation techniques that are more designed to help activate the parasympathetic nervous system so that you can relax and your body can become more relaxed, it in turn helps reduce some of the distress around those emotional experiences. And so I just want to highlight some skills that could be helpful. Self-soothing, if you really think of at our most basic level, when we are babies, this is how we're soothed, right? If you think of a crying child, we soothe them with the senses. We can't rationalize to them, how to feel differently, but rather we comfort them with touch, with, different soothing sounds. And so just like this, we can soothe ourselves using our 5 senses of vision, hearing, touch, taste, and smell. There's a lot of resources online and, activities you can look up to do this, but at a basic level, if you really think of anything that's soothing, things like listening to relaxing music or certain essential oils or lotions, right? We find that lavender, eucalyptus, there's certain scents that are very relaxing for us. Nature scenes, just visual scenes, meditation, so more formal mindfulness practice, deep breathing. Breathing is a very simple way, our breath is always with us, to focus our attention on something that's more neutral and relaxing. Belly breathing or abdominal breathing, so there's also resources online to help guide people with this. But practicing this just for a few minutes each day can really bring down the physiological sensations that we experience with stress. Progressive muscle relaxation is another way. It involves tensing and releasing our different muscle groups throughout the body to create an overall sense of relaxation. There's ways people can practice guided imagery. There's a lot of mindfulness apps out there, websites that have guided imagery. On YouTube, for example, you can find some if you just look them up. And also mindful movement, things like nature walks or yoga. And with these skills that I'm talking about today, my intention here is to provide skills that you can do in any situation, regardless of what restrictions are on us with social distancing or stay-at-home orders. So really things you can find in your toolbox wherever you are. And I think that's what's really great about different apps, relaxation or deep breathing or any of these. You really just need yourself, right? And perhaps a smartphone, but there are things you can really do anywhere. So another helpful skill to use is distraction. And I will definitely put the caveat out there that distraction really can be helpful in moments where we can't problem solve right away, right? So if you're in a distressing situation, intentions or emotions are really high, and in that moment, you can't really do anything to change what's going on, it can be helpful just to mentally set aside our problems and distract with other thoughts and activities. So the caveat here is absolutely to be used in the short term, right? So if you think about the current state of the world, if we had just been, I'm just going to distract, I'm going to kind of get in bed and get under my covers and watch reality TV for the past 4 months. For many of us, that would actually make our problems worse. It wouldn't make it better. So this is to be used in the short-term basis to get us through really stressful situations. So how can we get our mind off of our stressors? Well, you can get involved in really any activity that you can fully engage in. So this could be for some people things like knitting or reading, listening to music, really you name it, some type of activity that's going to be distracting for you. I mentioned reality TV or watching movies, right? And then also engaging in activities that might bring up very different emotions for you. So if you're experiencing a lot of sadness, it might be helpful to do things like watch funny, YouTube clips or watch stand-up comedy, something that's going to bring up a different emotion for you. Another way that we can distract in the moment in the short term is by occupying our mind with other thoughts. And so what I mean by this is things that might, if you think of when you're worried, right? We tend to focus on one thing and stay stuck on it, or kind of stay focused on the negative. It's really hard, or if not impossible, to have two thoughts at the same time. So if you are occupying your mind with other thoughts, like maybe you're working on word puzzles or Sudoku, doing something that requires a lot of thought in that moment, you can't do that and hold those thoughts and hold your stressors in your mind at the same time. So that's another thing you could try if those types of things interest you. A more kind of broad skill I wanted to talk about today has to do with how we talk to ourselves and what types of thoughts we tend to focus on. Now, for many of us, you might kind of understand this pretty quickly or recognize this pretty quickly, is we tend to, as humans, be really good at focusing on the negative. And we also tend to be really hard on ourselves and use pretty harsh language that we wouldn't use with other people. And so how we think and talk to ourselves can impact how we feel and really contribute to stress and hopelessness and low self-esteem. And so really being mindful of that language can be really helpful, and really asking yourselves, like, am I comparing myself to others unfairly? Do I notice that I'm like putting a lot of these judgments on myself, especially with social media? Think about, especially earlier on in this process, when a lot of us were spending more time at home or had more restrictions on where we could go. I think that led to a lot of people spending more time on the internet and on social media, and those are places where absolutely social comparison is rampant. And when we engage in that social comparison, it usually implies some type of deficit within ourselves, right? So what's wrong with me, or I want that, or I need that. And just be really mindful of your judgmental self-talk. Notice the things you're saying to yourself. And a way we can deal with that is reframing our judgments and using more gentle language. So asking yourself, how would I talk to someone that I really care about? Noticing those shoulds you put on yourself, right? I should be doing more. I should be more productive. I think that was one thing that really stuck out to me at the beginning of this process with, stay-at-home orders and COVID-19, is a lot of people feeling like, I should be using this time to be more productive, or to be, focusing on myself for self-improvement, or baking more, cooking more. And when we put these shoulds on ourselves, it really can put us down. So some ways to turn that around is you can use encouragement, right? We can cheerlead ourselves. I think this doesn't always fit for a lot of us, even though we might do this for other people. And just encourage people to try that if it does fit for you. Or really focusing more on positive affirmations. Some people will kind of repeat these to themselves, or there are even like guided meditations around loving kindness or affirmations that you can repeat to yourself. And if that's not quite in your wheelhouse, I think for a lot of people that feels uncomfortable or disingenuous, you can just focus more on like what you do appreciate about yourself, or look for positives, what are qualities that you like. But overall, the idea here is just being more gentle with ourselves each day can help improve our mood and how we respond to stressful situations. So the next skills I want to talk about have to do with reducing vulnerability to negative emotions and increasing our positive emotions. And so once again, I think when it comes to problematic eating patterns, often these come up because people are experiencing a lot of negative emotions and intense emotions. And so there are things we can do to structure into our daily routine to help with mood, and in turn help with our eating behaviors. And so hopefully you guys are picking up on this, but a lot of what I'm talking about, a lot of how we target problematic eating patterns really has to do with how we target our mood, because they're so closely linked for most people. So some ways we can do this is really actively working to each day do things that make us less vulnerable to negative emotions. And that might look like doing things each day that help you feel accomplished and masterful. So some examples of that might be different for different people. So one thing I want to highlight really, first with this is the idea here is not to like give yourself a bunch of challenges for the day and then have it be so overwhelming that you don't do it and then you feel bad about yourself. You want to start small. You want to be realistic, what feels attainable, and then you want to build up from there, because the idea is you're starting to collect more feelings of accomplishment. So I know for myself, one thing that really helps is, if you have a to-do list, just really like checking off things on your to-do list, right? Even things like chores around the house, like getting laundry done, you can feel really accomplished. Or going through old emails, cleaning out your inbox. making those doctor's appointments that you've been avoiding. Even things like crossword puzzles, right? Like, or puzzles, things that you are challenging but make you feel good when you complete them, or starting a new hobby, right? So there's a wide variety of things people can do here. So not only do we want to make sure we're helping ourselves build mastery and feel accomplished, but if you think of one of the most important things to reduce vulnerability to our negative emotional states is really to take care of our basic physical and health needs. And once again, this sounds so straightforward, and yet think about it. When you're most stressed, what are the things that go out the window, right? Usually our immune system gets compromised when we're stressed. And then maybe we try to push through, right? We'll just have this big deadline, or I'll sleep when I'm done with all of this, or I just have to get through this. And we push through in a way that if we don't treat physical illness, it actually makes us feel worse emotionally. Avoiding mood altering substances can be really important in times like this too. So once again, you might not struggle with substance abuse. However, even things like alcohol that we drink, that's pretty socially acceptable to do on a normal basis, alcohol is a depressant, and oftentimes people feel more depressed or anxious after they drink. So maybe not in the moment, but maybe the next day. So just being mindful of how mood altering substances can impact mood by nature, by their definition, and really getting balanced sleep. So also when we're stressed, what tends to happen, right? We tend to have more irregular sleep patterns, have a harder time falling asleep. And so really we would recommend, if you can, get up to 7 to 9 hours of consecutive sleep. It's different for different adults, what they need, but keeping a regular sleep and wake schedule, doing your best to try to go to bed at the same time each night, wake up around the same time, just getting regular sleep. Moderate exercise, similarly, right? And regular eating, when we are stressed, what we tend to do is let go of the self-care and focus more on all the things that have to get done. And I think usually the time that we would normally spend focusing on getting out, even walking or exercising or eating our, regular meals throughout the day, in times of stress, we forget about that. So this really just takes prioritizing your basic physical and health needs, being aware of that, and making sure you're doing that. And not only is structure and routine important to keep up these types of things in our daily routine, but also when we have structure and routine, it helps reduce boredom and impulsive behaviors. And I think that's one thing that I'm guessing in the current state of our world that's come up for a lot of people is structure and routine has really been disrupted. So how do you still create structure and routine in a way that is manageable, right? That is, even if you don't have to go to work every day, maybe you still get up and have a routine around the house of making breakfast and doing certain chores, and then maybe going off and doing some type of exercise and then coming back, right? So we can still create structure and routine even if our typical structure and routine has been disrupted. This also may sound really straightforward, and once again, this can be really hard to do, is in order to accumulate positive feelings, we have to do things that make us feel good. And so in times of stress, there's usually less opportunity for us to feel good about ourselves. We're focused on the things that are stressful and overwhelming for us. So what we want to do is actively seek out activities that we enjoy. And once again, even if there are restrictions in what you can do, where you can go, there's always going to be something you can access that might create positive emotions for you. And you might be the kind of person that you don't know what that is, or maybe those things are taken away from you right now. And so you might have to find new things, but there's a wide variety of things that you can try out, such as listed here, that will hopefully help with positive mood, taking on new hobbies, maybe trying to, enjoy nature in the moments that you can, things like even just taking a bubble bath, those little things that we might take for granted, but with time, as we continue to engage in them, they continue to bring up positive mood, and that buffers us against stress and intense emotions. Another thing I want to highlight here is really what we find is that loneliness, low self-esteem, right, negative mood, all those things can impact eating behaviors. And so it's really, social connection is really important to increase our connection, to reduce negative emotions and loneliness. once again, I know in the certain times of stress, it might feel a lot harder to do that. In fact, a lot of us might respond to stress by wanting to isolate and withdraw, right? We don't want people to be around us or people feel overwhelming. For each person, it's going to look different, but overall as humans, we do crave connection, and we do really need that to thrive. And so thinking about, even with limitations, how can you still reach out to your supports via phone, via text? Maybe you can do video chats with them. Maybe you can, even if you don't have a lot of support, maybe you do things to be around other people in a socially distanced way right now, but just to know that like you're not alone, right? Just to feel more connected. Right now, there's still opportunities to volunteer in a socially distanced way, whether you're contributing time or resources. There's online communities you can join. You can live stream virtual classes, be part of a group of some sort, engage in some type of virtual hangouts. So once again, if people have specific questions about how to do that, I'm happy to answer. But in general, this might take more planning and effort, but the idea is that you can still find social connection even if things are limited right now in how we can interact with people. And I think people are doing a great job of this, of really getting creative with how they're finding ways to connect. And so I just want to highlight before I wrap up today with kind of my part of just doing more of the talking at you, some resources. And so if you do have problematic eating behaviors, if you feel like you may have an eating disorder or struggle with a lot of these problematic patterns that I spoke about today, there's some workbooks here. I'll leave this up for a moment just so you can get if you need to get a screenshot or anything. But some workbooks that I would recommend that are really like self-guided. They give you activities to do. They provide a lot of education. And just more general readings that have to do with mindful eating and self-esteem that people find helpful. And then the last thing I want to highlight here in terms of resources, so I'm going to go ahead and switch the slide here, is if you think you do have an eating disorder, or you're here to support someone who you think may, the National Eating Disorders Association, or NEDA, has a very helpful website that that also has a lot of COVID-19 specific resources right now that if you go to this website, we'll be able to guide you in the direction of how to find a provider, how to kind of get more support and help. And they have a hotline and a lot of information. So just encourage you to go there if that's something that you're interested in. So hopefully with what I spoke about so far today, people get a sense of just generally some skills to support yourself with any of the maybe problematic eating behaviors or patterns that you might have. I'll go ahead and stop screen share right now so I can talk to you guys a little bit more. And I want to open it up to questions in these last 10 minutes here. What do people want to know? Is there anything I can clarify? Happy to answer what people are asking.
Hi, Kim. I went ahead and, sorry, Dr. Claudat. I went ahead and unmuted myself here. So yeah, if you guys have any more questions, you can keep them coming, but I have one here.
Okay.
So let me check this. Okay. How can we use these skills and continue using these skills when we aren't under stress?
I love that. So even in times when you're not stressed, how can you do that? So I think that that's a really important point, because I think that's actually a really important thing to keep up in your routine so that you can buffer against negative emotions and continue to create positive emotions. I think really when it comes to mental health and well-being and helping our mood, it's going to take an active effort no matter what. So I think we're usually more aware of needing these skills in times of stress. And in fact, I think it's more ideal to do it before you're stressed. I think that that can be really important. So I don't know if I would say there's anything in particular that you would need to do aside just from being really aware and mindful of that. I think with any behavior change, like if you're someone who this is not your typical routine, if actually a lot of this would be new for you to incorporate, just actively be mindful of that. If you have a planner or on your Google Calendar or just whatever method you use to plan out your week, like it might take some real planning. So There are, things you can do maybe in your journal or planner of just putting out, okay, each day I'm going to do one thing from each category, right? I'm going to do something for relaxation. I'm going to do something I enjoy. I'm going to focus on balanced eating. I'm going to set aside time for social time. It doesn't mean you have to do everything every day, but really looking at your week, look at what might seem balanced to you. And at first, it might really take an active effort to plan it out, and then it may become more part of your regular routine. So hopefully that answered the question.
Yes, great. Thank you so much. All right, another question. All right, what can you do immediately right then when you feel that urge to eat the whole bag of cookies?
Yes. So I love that, because a lot of what I talked about today was about all the things you can do before that happens. So I'm actually really glad someone brought that up, because for a lot of us, right, we might get to the point where we're in that moment and you need a skill right then and there. So just like I mentioned, the type of skill you're going to use is really going to depend on the reasoning behind the eating behavior. I think the first step is to ask yourself, if you can, so there's a few things I'm thinking. If you're in a highly emotionally distressed state when that's happening, it's probably going to be harder to like stop, think, go through all these things. And so the first thing would really just be that, stop, practice that, like noticing. A lot of these skills take awareness. So you notice the urge come up, you're like, okay, I want to eat that whole bag of cookies. And once again, I want to be, if this really was an unusual, like a large amount of food that you felt like this might be inappropriate, like you just might want to stop and think and ask yourself, like, where's this urge coming from? What's actually going on for me? So ask yourself, like, how am I feeling right now? And if it is like, I just feel really overwhelmed, I have too much on my plate and I'm feeling really lonely in this and like feeling like I don't have any support, then I would say, stop, get out of the kitchen or wherever you are and go do something to help with that emotion, right? So asking like, what am I feeling and what do I really need in this moment? And if it's like, I'm just going to call a friend, or I'm going to just step outside and take a few deep breaths and just kind of practice some skills to be more present and feel connected to the world, then that's what you do. But if you're noticing like, okay, I'm actually really hungry right now, I haven't eaten much today, like it's kind of like, okay, then how do I eat in a way that's appropriate? Like what I really need right now, it doesn't have to do with my emotions. It actually has to do with the fact that I'm hungry. So, do I want to eat all these cookies, or maybe I plate a couple of cookies and plate something else that feels like it'd be more of a balanced snack for me right now, or a meal. Maybe I really just need to have dinner. So hopefully that helps. I know it's hard when the answer is like, it depends, but it really does in this case, because you really want to ask yourself, what's really going on for me and what is this about? And is it because I'm hungry? Is it because, those cookies look really good and I haven't had them in forever? Is it because I'm feeling really sad or overwhelmed? So you want to ask yourself, what's the reason behind the behavior, and then target that. So hopefully that helps with that one too.
Yes, that is great. And also along those same lines, what do you suggest if you become too conscious of your eating habits or obsess over eating, and how do you balance that mindfulness?
Yes. So I'm thinking a couple of things here. I'm glad this got brought up too, because that can absolutely happen, right? A lot of the things I'm asking you guys to do or suggesting you do has to do with tracking what you eat, being really mindful of it. And for some people, that's actually more problematic than it is helpful. So I wouldn't say scrap it all together. Like I wouldn't say, don't worry about a meal plan or don't worry about eating regularly. I would say, be mindful of what's coming up and where that's coming from. So, still try to find some type of a regular eating schedule or pattern. But if you're noticing it's becoming too rigid, you might need support from other people to help you in that. So you might need to kind of let the people around you know that you need support, or you might need to kind of let go of the reins a little bit and practice flexibility. So what I mean by that is, like, if you're noticing you're sticking to certain rules or really tracking calories, or, really being rigid about how much you're eating and when and what, kind of practicing letting go a little bit more, and maybe purposely engaging in situations that would make you more flexible. So maybe, you eat with a friend or a family member and you kind of let them pick what you eat, or you're trying to be more flexible in that way. But for a lot of people, if that becomes too problematic, you might need additional support and you might want to seek treatment as well, because a lot of treatment is helping you figure out skills to manage the anxiety that comes around that. So if there's specifics about that, I'm happy to answer more, but generally that would be my recommendation.
Thank you, Kim. And also, so throughout the presentation, you've mentioned in a variety of ways how important it is to have a support system in place, family and friends that can help you if you're in need to cope with anxiety and stress and your eating behaviors. But I'm just wondering how you could best approach these conversations that are necessary with your support system that you would like to approach.
Yeah, so just to clarify, or just make sure I understand the question correctly, it's basically like, if you feel like you need more support in any of these areas, like how do you even like let people know that?
Exactly, yes.
Okay. I mean, I think once again, it depends on the relationship and the nature of it, and how comfortable you feel with someone. But I would argue, definitely pick someone that you feel safe with, someone that you think would be receptive and open. And if you're not sure who that person is, I think just like someone that you trust or generally feel comfortable with, because people might not always understand when we need support in situations like this, especially around eating. If people don't struggle with certain eating problems, they really might not get it. Like they might not understand, what do you mean? Like, how do you need support with that or why? So I think just really picking someone that you feel safe or comfortable with, and maybe just letting them know generally. Like, I think you can either be really upfront and say, I've noticed that when I've been more stressed, I'm struggling more with, I'm not as hungry and I'm avoiding a lot of food, and I really don't want that to become like a habit or problematic behavior. Would it be all right if would you be willing to support me in that? And maybe that just looks like reminding me to eat, right? It could be something simple like that, straightforward. You might also want to approach it in a way that's a little more indirect, just saying like, hey, could we make sure that we're eating together this week? Or would you be willing to cook or help me with this? So I think it depends on your relationship with that person and their role in your life. But I think you can either approach it in a very direct way and saying something like, this is what I'm experiencing. I'd really appreciate your support, and this is what it could look like. I think often it's really important for us to be specific in what we need from people in terms of support. If we just say, I'd like for you to support me, people would have no idea what that means. So letting them know, like, do I need encouragement? Do I need reminders? Do I need someone to eat with? Or maybe for, it could be asking someone, I'm really struggling with just some like problematic eating right now, and if it's okay, like I'd ask that we don't have this food in the house right now. Like if it's a risky food for you and you feel like you can't avoid binge eating on it or overeating, you might just have to ask them to keep certain foods out of the house. So there's a variety of ways, but I think if you can be direct, that's the best way to do it.
Great, thank you so much. Unfortunately, that was the last question that we have time for today, but just want to thank you, Dr. Claudat, for the informative lecture and for sharing this valuable information with our community. And so if you have any additional follow-up questions for our audience, feel free to email us at info@idpf.org. This webinar recording will be available on our website and our YouTube channel. I invite you all to visit www.idpf.org to learn more about upcoming webinars and to stay connected via our monthly e-newsletter. And thank you everyone for attending, and we wish you all a wonderful week.
Thank you so much. Thanks so much for having me.
Thank you. All right, bye-bye.
Bye.